morning. Oh, I'm looking a little bit windswept again today. So if only I could have nice straight hair, it would be so much easier. So welcome to this week's live. So I'm talking about vision changes as we age. As I said before, this was really triggered by seeing a post in another menopause group about someone complaining about the hormones affecting their vision. So I just wanted to go through that and just talk a little bit about that, because I think there's a little bit of a myth. Yes, we can get dry eyes as we get menopause, but that can affect your vision. But the other changes in your vision is not due to that. That is due to basically us aging. And you know, we all age. So I'm just going to talk a little bit about that. And I just want to reiterate that we shouldn't be blaming everything that we feel on menopause. If it's something really weird and wonderful and you're worried about it, you know, go speak to the doctor just to get it, you know, put your mind at rest. But don't just take it that, oh, this is due to menopause and stuff like that. So eyes. I don't know if you've heard me say before, but I in a previous life when I worked in prior to sort of coming back to the UK and sort of doing non-clinical work, I worked in ophthalmics. I used to work in the ophthalmic theatre. I got the job as a team leader in the ophthalmic theatre, having never done it before. I remember I had worked on the ophthalmic ward as one of my last wards in my training back in the 80s, and that was when cataract patients were inpatients. They used to have to lie flat for 12 hours after surgery. They were in hospital for probably about 5 days. Now they're in and out within a few hours. So that was all I knew about ophthalmics, a little bit that I'd done sort of 20 years earlier. So I went for the team leader job, and my friend told me, she said, if they ask you about what you know about eyes, tell them you've got two and they come in different colours. And basically, starting the job in the theatre, that is all I knew about ophthalmics. That's the only thing I knew about eyes. We had two and they come in different colours. So the theatre we worked in was majority was cataract surgery, and we did a bit of paediatric surgery, so squints, did a bit of glaucoma surgery, and then we had a surgeon that came and did oculoplastic. So basically that was doing, if you've got really sort of runny eyes, doing surgery to help with the drainage from the tear duct, interning eyelids, reversing the turn outwards, enucleations, that's removing the eye, or eviscerations, that's removing the contents of the eyeball for whatever reason. And then I went and so I got the team leader job to help understand what we were actually doing and understand about ophthalmics. I did an ophthalmic course via the Queensland University, and a few years later there was a private day case ophthalmic hospital opening, so I moved there, and over there we did retinal surgery as well. So basically detached retinas, vitrectomies, anything right at the back of the eye, we were doing that there. So we did a bit of everything there. So eyes was one of my favourite areas. I loved the ophthalmics. So that's why I thought I'd talk a little bit about it today. So in relation to menopause, as we know, estrogen is important. That it helps sort of keeping areas moist, so it helps with sort of producing the saliva, making sure you've got enough saliva. It keeps your skin now. It helps with skin moisture. It helps with everything. And as it starts to decrease in estrogen, we lose some of that ability to produce those fluids, and the tear film, which is over the eye, which is a bit mixture of water and a bit of sort of, I can't remember what the word is, a little bit of waxy, not waxy subject, but a little bit of sort of oily oil. That's what keeps the cornea, which is the lens, which is what we see through. Retinal surgeons will call it the dust cap. So, so you imagine this is like the windscreen on a car, the front of the eye. So that is lubricated with the tear film, and that's done when you're blinking. And if you've not got enough tear film, if you're not producing enough tear film, that's when the eye gets sort of really dry, it gets gritty, it gets stingy, and your vision can get blurred because you're not cleaning, basically you're not cleaning the windscreen. So you can buy over-the-counter drops. If you're really worried, make sure you go to the opticians and get an eye check. To help reduce dry eyes, you can limit your screen time, because if you imagine the light from a screen sort of glaring at your eye, that will dry it out. Just imagine going in the sun, it's just exactly the same, you burn your skin. Protect your eyes in cold weather, because the wind can cause the tear film to evaporate quicker. So use wraparound glasses. If you use contact lenses, having using shorter, limiting the use that you're using them, so maybe not keeping them in all day and stuff like that. Look for if there's other triggers. There might be another trigger that's you've noticed that after you've done something, your eyes are a lot drier. To help, you could use a humidifier to help reduce the evaporation of the tear film. A diet high in omega-3 from oily fish and eggs and dairy can help improve production. So that is what is related to menopause with eyes. Changes in your vision is due to age. It's not hormonal, it's due to age. So going back to anatomy, if you think of the front of the eye, we've got the lens, like I say, the windscreen. Behind that is you've got the iris, that's the coloured bit, that's the bit that opens and closes depending on the light, on the amount of light, so it can absorb, the eye can absorb what you're looking at. And behind that you've got the lens. Now the lens is the smallest organ in the world, not in the world, in the body, and the lens is in a bag. So if you imagine the lens is in like a shopping bag, so when it sheds, everything stays in the shopping bag itself. So when you do a cataract, you have a cataract removed, there's a hole ripped in the top of the bag, and then the lens is sucked out from there, and they leave if all goes to plan, they leave the sac in place, and they insert the new lens into the lens bag. Now the lens bag just doesn't sit there on its own in sort of the animation, I can't remember what they call this animation thing where you just lie there. The lens bag is held in place by tiny little ligaments that are all the way around that hold it onto the inside of the eye, and they're called zonules. And the one thing I remember about zonules is when I started in theatre, the girl I took over the job from had become a medical rep she was selling lenses for cataracts, for after cataract removal. And she said to me, Julie, the zonules, no one's ever seen the zonules. We know they're there, but no one's ever seen them. So I said to her, well, if no one's ever seen them, how do we know they're there? I said, it's like an elephant being in the fridge. How do we know when we shut the door and the light goes out that there's not an elephant sat in that fridge? So I think she was talking a little bit of rubbish there, but hey ho. So the zonules hold the sac in place. Now as we get older, those zonules start to weaken, and then that can cause problems, especially sort of during surgery when you're moving around the bag, and it can cause like the lens to drop down the back of the eye, which is a complication of cataract surgery. So you've got these zonules. So the lens is thing that focuses what you're looking at, so we can work out what that thing is that we can see in front of us. And the lens, to be able to focus, the lens will squish up, it will widen out and squish up depending on the distance that we're looking at. As we get older, the ability for the lens to squish up and stretch out and focus deteriorates. That is why we end up wearing glasses, because everything we look at, suddenly becomes fuzzy, and we need the lens of the glasses to help with the focus of the natural lens, because it's not able to focus itself. That is called presbyopia. It is a normal part of aging. It is not hormone related. It's nothing to do with the lack of estrogen, because it's just age related. And that can happen at any time. I was in my 40s, and the only reason I started wearing glasses is because when I was in sort of ophthalmic theatre, the intraocular lens, we're talking, the millimetres, a few millimetres in length, and we had to fold, what they said called fold them, so they go into a cartridge that go through at the time it was a 2.2 millimetre incision in the eye. Excuse me. And the aim of folding the lens is, a lens has so if you imagine a circle, it's got one leg going up and one leg going down, so you had to wrap the legs in. So when you folded the lens and it came out of the cartridge, it came out in like a roll, and it didn't come out with like a leg sticking out, because if you have a leg sticking out, that was really challenging, because that could tear the capsule bag, which would make the lens drop into the back of the eye. So I was struggling to see these lenses that we had to fold, which is why I ended up getting glasses. It wasn't because I couldn't see what I was reading, it was literally I couldn't see these lenses that were a few millimetres, and usually they were clear. So imagine trying to pick up that and sort of fold it in and get it in a cartridge, and so that's why we end up with glasses. And that, like I say, that is a totally natural thing of age. Cataracts are when the lens starts to go foggy. So usually it's very crystal clear, so you can see through it. Cataracts are the lens is just starting to become hard, and it's less clear. Left it without, if you don't treat them, if you don't have your cataracts removed, they will eventually go pure white. And you'll notice if you look around elderly dogs, although they can do cataract surgery on dogs, elderly dogs who've got cataracts, the chances are the eye will look pure white. A lot of people sort of in the third world will have the white cataracts, which are what ophthalmologists will call count fingers cataracts. That means that when they're checking the eye and they're looking at the eye chart, they can't see the eye chart. So what they'll do is they'll hold fingers up in front of them, and basically that's all they'll see. And it's amazing when we did some charity work with some people when I was in New Zealand. Came over from the islands. They had no access to medical care over there. These ladies came over, patients came over, have the cataracts removed. They come in blind. They go out basically being able to see. It's an amazing operation, and it's basically it's one of the life-changing operations, cataract surgery. So imagine if you can't see, suddenly having something in your eye that allows you vision is amazing. So that is what cataracts, again, natural form, part of aging. It's not hormone related. Other things that can go wrong at the back of the eye are things like glaucoma. Glaucoma is all to do with the eye being able to drain the fluid that's in it. It has a drainage system. If that stops working, the pressure will go up in the eye, which will cause it to become very, very painful. Put pressure on the macula, which is the central vision part of the eye that's right at the back of the eyeball, and will start damaging the vessels and the nerves, which then affects the ability to see. And people with glaucoma will have patches in their vision where they can't see. So if you lose any vision gradually, sort of in patches, you make sure you go and get your eyes tested. Macular degeneration, that is when the macula, like I said, that's a little disc at the back of the eye, that is where your central vision is. That is, the blood vessels start busting around there, and the macula stops working, and they will lose central vision. So they will be able to see, but the middle of their vision will be blacked out. So, like I say, any changes in your eye vision, that's why it's really important you get your eyes go on a regular basis to check your eyes. And depending on the severity of your vision will also impact your ability to drive. So if you're diagnosed with anything, it's worth keeping an eye on, speaking to the specialist or the optometrist or the optician about making sure that you're able to drive, and sort of letting the DVLA know if you need to. The other thing that can happen with your eye is retinal detachments. That's not necessarily a hormonal thing, that can happen at any point, at any age, and that is a sudden loss of vision, potentially in one eye. And that is, the retina is what covers the inside of the eyeball. It's got all the blood vessels in it and things like that, and it will start to peel off the eyeball. So if you imagine wallpaper, the retina as wallpaper, it starts peeling off, and that is an ophthalmic emergency. You need to go into hospital. They need to in the back of the eye there's like a jelly that holds the retina in place. They need to remove all that jelly, and they will put something in to sort of basically flatten, weight back the retina back down. Depending on where the detachment is, you will have to lie down in a certain position for several days. You only get short breaks, and some people have to lie down prone, which is face down. Some people will have to lie on the side, some people have to lie on the back, because you want to make sure that the retina attaches back to the eyeball. And they can put, depending on the surgeon and the detachment, they will put a gas bubble in that will hold it down, or they may put a heavy gel in it, or they just may put a little bit of pressure, or they can even laser. Sometimes they will laser it depending on the severity of the detachment. So any issues with your sort of cornea, like I say, dry eyes will cause it to be a bit blurred. So if you're noticing that, it might be worth going to get your eyes checked just to make sure everything's okay. The opticians, I'm sure, will sort of have eye drops that you can use to make sure that your eyes are moist. The other thing you can do, if the glands around your eye, your eyelashes, if they're blocked, maybe I always advise to use like a hot, warm cotton pad just to put it on, just to sort of try and encourage the oils to come out, and to sort of help with the moisture and things like that. So unfortunately, as we age, and when you go and get your eyes tested every time you go, likely it's changed, so you'll have to get new glasses and stuff like that. But unfortunately, that's just ways of life. When you have cataract surgery, what they will do is they will make a decision on where they want your vision. It may be that they will give you really long good vision, but you'll need glasses for reading. But that's something that you would have a discussion with the ophthalmologist at the appointment, because when they do all their checks and things like that, they'll check the length of your eye to see if you're short-sighted or long-sighted, and then they'll make that decision specifically on where they want your vision to be, and then they'll check it after, and hopefully their plans will be right, and you'll have really good vision after. The thing with cataract surgery, sometimes they don't removing the eye, but the lens, they can't sometimes get a few cells get left on the sort of the eye, the bag, and they will start to grow on the lens, and that can cause sort of you to lose vision after you've gained it. And what they usually do is they just laser that off. And I know when Mum had her cataract done, she needed to go back and get the lens lasered just to clear off those bits of cells that were growing on the lens. But she's, since having hers done, her vision's been great. And I used to love chatting to the patients who were coming back for their second eye and saying to them, how did you find after your first surgery, when you had your cataract done? And a lot would go, I didn't realise how grey I was, or I didn't realise how many wrinkles my husband had, or I didn't realise how dusty the house was, because you can't see it, because your vision's a bit fuzzy. You don't see those things, and then they come back sort of with clear vision, and they've got like a different outlook on life. So that is a vision as we age. So sort of, like I say, to manage sort of the dryness, I mean, we did talk about itchy skin and dryness and things like that a couple of months ago. Make sure you're really well hydrated. You want to make sure that you're putting the water into the body to make sure it can function. So, and make sure it's water based. It's not caffeine, it's not just alcohol, because caffeine and alcohol are both diuretics, which mean it draws the water out of the body. So you're wanting to drink either water, or so I drink cordial because I can't drink neat water, or maybe put some fruit in the water, or however you drink it. And eating sort of vegetables and fruit that are really water based, that will help with your intake as well. So that is that for eyes. My mouth is now dry because I've been talking. Just check there's no questions coming up, and can't see anything. Nope. So that is all for tonight. So another tip is make sure you take all your eye makeup off at night, because that can cause infections in the eye and stuff like that, which you really don't want. So I think that is all for now. And like I said before, Facebook are only allowing lives to be up for 30 days. So what I'm doing, I'm downloading them, and then I'm going to pop them on my YouTube channel, which is at Julie Menopause Coach. So it's really easy to remember. Think, who am I? Go and find me on YouTube, and you can go and re-watch them as well. So any questions regarding eyeballs, drop them in the comments, send me a message, and I will try and help you as much as I can. If you watch on replay, please do put replay, or say hello, or say something. Let me know if this information is, if it's helpful. I'd really appreciate that. So that is it for tonight, and next Thursday I'm going to do joint pain and talk about inflammation in the body, and how we can best manage that as well. So 25 minutes. Started off with a bit of IT issues, but managed to get it out. So have a great evening, and thanks for watching.